I think it's live now. I am doing this on my laptop, which I've now bolstered up on lots of books and things because I've seen that's the way to do it. Because my desktop, I've actually turned my desktop off when I went on holiday, and I've just turned it back on again, and it's taking ages. So I'm on my laptop. So I think my laptop's got an integral microphone. So I know the Instagram's on my phone, so I know that's got a microphone. I'm assuming the laptop. Does the laptop have an? Can you hear me on Facebook/YouTube? Is there a microphone? Yes, I think there's a little dotted thing going across. I think it's okay. I'm hoping you can hear me on Facebook. I'm just going to push on as if you can. I'm on the laptop. On the laptop. Anyway, yes, on FB. Fifi, thank you. Good. So there we go. So here we go. So got some questions here. Been off for a couple of weeks. And very, very glad to be back and back in on the saddle, as it were. And if you've got a question yourself, feel free to post it. If you haven't, sit back, relax, put your seats in the upright position, armrest down, because yeah, that's right, we're about to take off. Let's do this thing. What do we got? Well, I'll tell you what we got. We got this question right here, right now. This is happening live in real time. It's not showing. There we go. So on Facebook, I think on YouTube as well. I'm not sure what goes on YouTube, to be honest with you. The YouTube, we haven't been doing much on YouTube. I'm fully admit that. But here we go. Computer's starting now. Yeah, a lot of views are starting now. 7:06, mate. It's supposed to start at 7. Honestly. But we are looking to do more videos coming up, and they say that it's better to delete your YouTube channel and start afresh. I don't, because I've got like 1,000 or more subscribers on YouTube. Can I really throw that away and start afresh? Anyway, but anyway, whether or not we do that, we're going to be doing more YouTubes coming soon. Watch this space. But at the moment, yeah, I think this goes on YouTube, and yeah, not sure how much we're putting on YouTube at the moment. Anyway, we're digressing. Come on, guys, let's do this question, which says, do you do raised birthmark removal? So that's quite specific, isn't it? Raised birthmark removal. Well, raised is sort of irrelevant, really, whether it's raised or not. So I guess the question is, do you do birthmark removal? And the answer is yes. Well, yes. I mean, when we have split these questions up on YouTube, I do get a lot of criticism for being vague and not answering the question. So I do my best to answer the question. So yes, if I can just say yes. But having said that, there's quite a spectrum in terms of birthmarks, and there are different types of birthmarks, and there are particularly different sizes. So a little bit like the tattoo thing, it depends on size and location. So the thing that we would be doing to a birthmark, if we were doing anything in my clinic, would be cutting it out. That would be the modality of treatment. It would be a cutting out type treatment. So it depends on the size and location. So if you have a very big birthmark, and particularly birthmarks that are around difficult areas like the eye, the mouth, the nose, things like that, that would need specialist treatment. Which is usually in children's hospitals. These things are often treated in childhood, but sometimes in adults too. And then you might be looking at other modalities of treatments, things like laser, and there's other sorts of things you can do for birthmarks. In fact, birthmark treatment, if you like, is actually a specialty of its own. And there are some people who specialize in treatment of birthmarks, and they treat particularly troublesome one. So if it's a big one, a troublesome one, then you might want to see a specialist, which would usually be a pediatric plastic surgeon who would specialize in that area. But if it's a small one, then it can be removed by excision as long as there's enough skin laxity. So yes, we do treat birthmarks in the same way that we treat moles and remove tattoos and other bits of skin, but it does depend on the size and the location of the birthmark, and if it is a particularly big one, or if it's a child, because we can't treat anyone under the age of 18. It's a CQC edict or ruling, if you like. We do have pediatric plastic surgeons and pediatric nurses and things, but it's really an edict for the clinic that we've just said, because of there's quite a lot of protocols you have to put in place to treat children. And I know that a 16, 17-year-old, would that still be classified as a child? Well, yes, it is in medical terms. So we cannot treat anyone less than 18. So if you're less than 18, or if it's a big troublesome birthmark, then you might want to seek specialist advice. I'm not sure who does it. I think I keep on recommending Hiroshi Nishikawa at Children's Hospital, and he works at the Westbourne Centre as well. But I don't even know if he's still working. But if he is, then he's a good plastic surgeon. I think he treats these things. But yeah, so I'm not sure who treats them. But if it's a small one in an easy location, we would treat it anyway. Going on a bit about that one, Jay, aren't you? Let's move on. Should we move on? Yeah, why not? Is tummy tuck preformed? Oh, spelling team. I mean, I know I'm the ultimate responsible for these sorts of things, but I only just noticed it. Performed, gloss over it, Jay, under Twilight or General Anaesthetic. Well, it can be performed under either. So it can be performed under Twilight or General Anaesthetic. I veer more towards General Anaesthetic. I'll be honest with you, I do veer more towards anaesthetic. In general terms, we are veering away a bit from general and doing more and more things under local and sedation or Twilight anaesthetic. And there are many things that you can do under Twilight anaesthetics. But I think a lot of this is driven by the fact that some clinics, some places can only do local and sedation. And certainly over the lockdown, there were some places we could only do local and sedation. And it is a fact that you can do quite a lot under local anesthetic and sedation, and it is great. But now the hospitals have opened up again and we're doing things in the hospitals. For me personally, I would prefer to do a tummy tuck under a general anaesthetic, unless the patient was very motivated, and it can be done. People are doing it under general anaesthetic safely, but for me, I think it's the upper end of what you can do under a local anaesthetic with sedation, and I would be more in my comfort zone in the general anaesthetic arena. But it is a bit surgeon dependent. Some surgeons will be, definitely general. In fact, I think most surgeons will be general, to be honest. But there are some surgeons who would be more confident doing it under local insulation than me, perhaps. That's the way of saying it. I have done it under local insulation, under Twilight, and it has been fine, to be fair. So it's not that there's a problem, but it just makes a bit of an extra level of complexity to it. It's a little bit more uncomfortable. There's quite a lot of work being done with a tummy tuck, and you don't really want to be compromising that in terms of just for the sake of the anaesthetic. So personally, I'm more of a general anaesthetic guy for a tummy tuck into sedation. Although in the world it is being done under Twilight, and it's certainly a possibility to be discussed. We've got something coming in on Instagram Live. What we got? Natalie, Ali Nicholas said, "You're the man. I'll be insuring about birthmark removal. I'm guessing price ranges depend on size, area." Yes. Crumbs. Good old Alison Nicholas. Thank you. Price does depend on size. I mean, and again, I got a lot of stick on the. I did a video on YouTube called "Cost of Mole Removal," and basically, I didn't say what the cost of mole was, and a lot of people say you didn't say. So what? I tell you what, Natalie, the thing to do: send us a photo. And then it's a lot easier, because if I say the price is this and then you send us, then I see you and I say the price is that, and you say you said the price was this, and I'm like, yeah, but I was talking about a little thing here, a little tiny little thing, and you got a massive great big thing, and then you're going to get annoyed because you're saying, oh, you are. So it's better if you send us a photo. We'll have a look at it. We'll say, look, it's a goer or not, because it might not be a goer. And, that saves everyone, at least saves you the trouble of coming. If it's not a goer, then we might say, look, you might want to look at laser or some other sorts of treatment for it. But if it is a goer, we can give you an idea on how much it might cost. So that's probably the best thing in terms of that. And then we can also say what's included in the price, because a lot of, that there is a huge range of prices you can pay for this sort of stuff, whether it be a mole removal or a a birthmark. Yeah, I thought I guessed you meant inquiring. And we just say, look, this is what we offer, and this is where we're placed in the marketplace, and you will be welcome to come and have a chat, or send us photos and stuff like that if you're not sure. Photos usually the best thing for moles and birthmarks and things like that. If you've got a lesion, you want an idea of price, or tattoos are classic. You want an idea about price, send us a photo, and then we'll say, yeah, either it might, because it might not be a goer. The vast majority, particularly for tattoos, the vast majority, 80, maybe even more, 90% of the photos we get sent, and we get sent a lot, like every day we're getting photos, it's a no. It's just like, no, it's not a goer. So that's, forget the price. No, there's no price because it's not a goer. So is it a goer? And what sort of price it would be? Then we can give you a bit more advice on that, and maybe multiple operations, particularly for tattoos. Sometimes they need multiple operations and stuff like that. Just have my dinner. It's okay. Do you perform umbilicoplasty, outie to innie? Yeah, not a common op, I've got to be honest. But if you want someone to do surgery to your umbilicus, I guess a plastic surgeon's a guy. I mean, you've got to see what sort of surgeon would do umbilicus surgery, and certainly there are lots of ways of fashioning an umbilicus. Would you believe? It's a bit like anything. It's a bit like you go to Smith's, or you go to Smith's is probably the best example, but I was going to say Sainsbury's and that, but Smith's has got a lot more magazines. I'm ahead of myself here. About magazines, you go to the magazine section of the shop and you look at running, and there's like 5 magazines on running, and they bring there every month. I mean, what can you say about running? It's like, how do they produce stuff every month? What is there to say about running? So what I'm getting at is whatever. Oh, hi, Kelsey. Nice to see you. Thank you for joining. Nice to see you tonight. So the point is, once you get into something, you realize there's people out there who are really into it and will give you stuff about the diet of running and the shoes and the exercises, and then I don't even know what they do on running magazines, but whatever they talk about in running magazines. And it's the same for umbilicoplasty. That's how I'm bringing it back to the subject in matter. Umbilicoplasty, what you do, how you refashion an umbilicus, whether that be after a tummy tuck or after someone who's born without a belly button. So often people with exomphalos and some people are born with a deficient abdominal wall and they don't have a belly button. So there are lots of people out there who've gone in there and studied it. And actually, I've written a paper on it myself, since you ask, on how you do the belly button after tummy tuck. And when you do that sort of stuff, when you write papers about things, you actually do lots of research and you get into it, and you get onto all the medical databases, and you find there's loads of papers of other people who've written papers on how you make a belly button and what constitutes a good looking belly button, etc. So if you're going to have anyone do something to your belly button, I guess it'll be a plastic surgeon. It's not a common thing. You'd think it'd be a common thing, wouldn't you? Now I'm reading it, outie to innie. You think, because a lot of people complain about an outie, but it's not actually a common thing. But if you have got it would be possible to try and do something to it. Don't ask me for a price because I've got no idea. That's another one for a photo, because you've got to look at what's going on. You've got to think, have you got a hernia there? Because there might be a hernia associated with it, which puts a bit of a different spin on it if there's a hernia there. But so I guess if there's a hernia, that will be a general surgeon. So having said it, be plastic surgeon who deals with that. I guess it would be a plastic surgeon or a general surgeon. So hernias are good at, general surgeons are good at hernias. Oh, that's a question, actually. Is that... Oh, yeah. Oh, don't talk too much about that. I've got a question later on about that. But, yeah, we do umbilicoplasty. Hope you and the team are okay. Yes, we are, Kelsey. Well, I'll speak for myself. Yeah, I am. I think they're all right, the A team. Now, what's this all about? Do you offer hip augmentation as one of your procedures? I don't know if anyone can help me with this. Hip augmentation. Not entirely sure what a hip augmentation. Do people want their hips augmented? is that a thing? Augmenting your hips? Yeah, maybe it is. I don't know, but I'm going to say no. We don't offer hip. I've never done a hip augmentation knowingly. I've never augmented a hip. One of the things about plastic surgery, and one of the things that's kind of attracted me to it, because I wanted to do general surgery when I was doing my training. I always wanted to do general surgery when I was a junior doctor. And when you're a junior doctor, you have to do different placements. So you have to do general surgery, orthopedic. There's a few definites. You have to do A&E, orthopedics, and general surgery. I think those are the definites, and then you can do some other things like neurosurgery or plastic surgery or cardiothoracic surgery or ENT or whatever. And I just happened to do plastic surgery as one of those extras. I will have my heart set on general surgery, bowel surgery in particular, and I just liked plastics from there, and then I ended up doing plastics from there. But one of the things you find about plastic surgery that is different to lots of other surgery is it is quite varied. And plastic surgeons are one of the few surgeons to operate on pretty much any part of the body. We will operate from head to toe, and it is, your lists are quite varied, and the things you do are quite varied. When you have, like, if you're a cardiothoracic surgeon, you'll be doing a valve replacement, and it gets so specialized. And to be fair, plastic surgery is getting pretty specialized now as well. But you will just be doing valve, so cardiothoracics is now what cardiac and thoracic, you don't even do both. You're either a thoracic surgeon or a cardiac surgeon. And orthopedics, you'll just do like one joint. You'll be shoulders, or you'll be hips, you'll be knees. You'll just do that all the time, and they'll do the same operation all the time. But plastic surgery has still got a bit of variety with it. There's still some things you sort of scratch your chin, itchy chin, and think, what should I do with that? So there are sometimes cases where we think, oh, how can we do that? So on the face of it, if you said, do I do hip augmentation? I'd say no. But on a case-by-case basis, if someone comes with a particular problem and something that there's a deficiency there or a deficit, plastic surgery is all about reconstructive and aesthetic surgery. We have a background of reconstructive surgery for people who are born with congenital defects or who have loss of form or function from trauma or from cancer or from whatever. And so we do reconstruct things. So if there was a specific problem, then never say never. We could have a look at it. But the way the question is phrased, do you offer hip augmentation, makes it sound like it's a thing. If it is a thing, I'm sorry, I didn't know it was a thing, and I'm probably not your guy because I'm not. I don't know how you would augment a hip. Fat grafting would it be? I don't know. It'll probably become a big thing next month, and then this will be out there saying I don't, and then I'll try and get into it, and then there's this thing me saying I didn't never heard of it. But anyway, as of the 26th of July 2022, I've not heard of it. If it becomes a big thing and I become a world expert in it, then let's just try and delete this video. But as it stands, hip augmentation is not in my repertoire, so I'm probably not your guy. Don't know who would be your guy, but anyway. Do you do belly hernia repair? As if your primary problem is a hernia, is an abdominal hernia, we wouldn't do a hernia repair. Would not be the primary operation. So if you've got a hernia and you want to have it treated, you would be seeing a general surgeon. General surgeons basically, as I say, we operate in all parts of the body, head to toe, but we operate on soft tissues. So we operate on skin and fat, broadly speaking, to put it sort of, we operate on the soft tissues. And then other sorts of surgeons operate deeper, like in the brain or in the heart and the lungs and the bowels. And the bowel surgeon is a general surgeon. So general surgeons do things with your stomach and with your intestines and things like that, and your livers and what have you, your spleen. That would all be a general surgeon. And general surgeon would be someone who would repair a hernia, and a hernia is a defect in the abdominal wall. So when we do surgery on the abdomen, we do everything superficial to the abdominal wall, which is basically skin and fat. We will sometimes tighten the muscles, which is doing something to the abdominal wall, but if there's a particular defect in the abdominal wall for whatever reason, sometimes people are born with defects, sometimes people have had surgery and have had scarring, which weakens the abdominal wall, or whatever the reason that you've got a specific hernia of your abdomen, then that would be treated by a general surgeon. And they have lots of techniques where they can repair it. They can either repair it directly or they can use meshes, which will reinforce the repair. And they are the specialists in that treatment. So if your particular presenting complaint is an abdominal hernia, then, and you came to see a plastic surgeon, then if you came to see me, I would refer you on to a general surgeon and say, look, these guys are the experts at fixing these problems. Now, having said that, we do sometimes see people with small defects and small hernias, and usually that would be in the course of an abdominoplasty. So that would be a standard situation where you have an abdominoplasty and you see a small, either a frank hernia, which is basically a hole in the abdominal wall, or much more commonly, just a weakness of the abdominal wall. It's not strictly a hernia. People think it's a hernia, and it's a bulge in the upper abdomen above the belly button, a bulge above the belly button. So it's called divarification or diastasis of the recti muscles. The recti are the six-pack muscles. You have two rectus muscles, rectus abdominis muscles going either side of your belly button, and that's your six-pack. And sometimes they get a bit widened, and the distance between them stretches a bit, and then the tissue between the muscles is a little bit weak. And so if you cough, or if you lift your head up, or if you lift your legs up, you get a bulge because there's a weakness of the wall. It's not a hole in the wall. It's not actually a hernia. People might think it's a hernia because it looks the same. But, a bulge when you cough is also what a hernia looks like. But this is not actually a true hernia. It's just a weakness between the muscles and a weakness in the abdominal wall causing that bulge. And that's actually quite common. And that is a routine part of an abdominoplasty, to bring those muscles together, to strengthen that so that you don't have that distance between them and you don't have that bulge. So repairing the divarification of the recti muscles is a routine part of a tummy tuck. And sometimes you will see a small hernia, usually around the belly button, a small hole. And I'm talking about that big, like tiny little hole by the belly button. And it's quite easy to put a stitch in and repair that. So on paper, that would be called a hernia repair. But in fact, it's not like a proper hernia which the general surgeons would be treating, which would be a big defect in the abdominal wall where they're using meshes and all sorts of bits and bobs to repair that. So we do repair hernias, as I say, usually during a tummy tuck if there's a little bit of a bulge or a small defect in the abdominal wall. But if there was a significant defect in the abdominal wall, a significant problem with a hernia, if it was a primary procedure, then I would suggest general surgery completely. If it was as well as a tummy tuck, so if you want a tummy tuck and you also have a hernia, then maybe joint procedure or talk with the general surgeons to see about doing it together, that kind of thing. So yeah, again, something to be discussed at consultation. Last question here. Now, I don't know if I look like I'm going quickly, but my daughter has ordered a Too Good to Go. Although we've got to pick up at 8 o'clock, she's got into Too Good to Go because she's trying to save the environment and my out-of-date food. So we are not out of date, nearly out of date. So we've got that booked in. But I now realise I perhaps over-egged it a bit because it's only 7:30 and we've got to get there at 8. So my last question. So if you do have a question, do ask it, because I don't want to. Anyway, I'll see if I can drag this out. Is it possible to have a breast lift when you have already got implants? Is it possible to have a breast lift? Implants are 18 years old, no problems. Should I get them replaced due to the age? This is something which would need discussion, but a lot of this stuff it is difficult. I don't know if it probably doesn't show because I'm so seamless doing this, but it is quite difficult doing this, doing what I'm doing right now. I know I make it look easy, but it is actually quite difficult answering questions without the full picture. Without basically without seeing people. Examining people. As doctors, I should have a disclaimer. Saying this is all like based on what I'm reading that you've told me, there might be some reason that what I say is not relevant because of this or that, because if you've got a different problem or if there's something else. So it is quite hard talking in general terms. So all of these things really need a discussion with the patient to say, what are your goals? What are your expectations? What we're looking, what sort of situation your implants are in at this present time. Because as a rule, if you have implants in, I've got a question. Awesome. I've got a question. Bow Sam, I got your question. I will answer it. Yes, thank you for that. Broadly speaking, if you've got implants in and if you've had them in for 18 years, a lot of people say got to be changed every 10 years. They haven't got to be changed every 10 years. If you've got implants in for 18 years and you've got no problems with them, I'd say, look, that's it. Leave them alone. Don't do anything with them. Happy days. However, it is a little bit complicated if you're going to have a lift. Because then the question is, that is the question. What are we going to do with the implants? Are we going to change them or not? Hi, Bev. Good to see you. So, my feeling, if I had to give an opinion, which is why I'm here, I guess, my opinion, is that if you're going to have surgery, I would probably suggest it wouldn't be a bad idea to change them. If they're 18 years old, there is a good chance you might start to get problems particularly in terms of them going hard. They might be ruptured. Sometimes, you can do scans for that, but sometimes we just find it when you actually do surgery. So, it would be a bit annoying if you went through surgery and then 2 or 3 years later, then you developed some hardening of your implants. It's like, oh, goodness me. That's annoying because I had surgery 2 years ago to have a lift. And so I would say I would probably recommend, if you like, changing your implants. Now, the problem with doing that is there's an extra cost associated with it, and there's complications associated with any surgery. So there'll be complications associated with changing the implant, particularly probably the one that we're more worried about is infection. Because if you have an infection around the implant, you have to remove the implant. So that's a big potential problem. But and so we have to have a discussion around that. But I think if you've got 18-year-old implants and you are having surgery, if you're not having surgery, by all means leave them. But if you're having surgery anyway to have a lift, I would say it would probably be worth changing the implants at the time, just because there's a good chance that in the next few years you might get a problem. Saved from the questions. Here we go. Bow Sam, I'm 9 months post-op from gastric sleeve and just £11 for my goal. What is best to have plastics? Thank you. Well, Bow, if you mind, if I might call you Bow. Interesting. This is opens up the debate of like what do I need type thing. People who come to the clinic and say, what do you think? What do I need? What do you think? Breasts, tummy, arms, legs, whatever, face. Don't do faces, but if someone comes to the clinic and says, what do you think? What do I need? I'm like that. You don't need any, no one needs anything, that you can carry on as you are. So we're very much guided by you. It really does depend on what you feel is the problem, because it's very difficult for us / me to tell you need a breast lift, for instance, or a tummy tuck, or an arm lift, or a thigh lift, or a facelift, or whatever, all the things that you might need if you've lost a lot of weight. So it is very much directed on what the problem is. I see people, a lot of my work is breast, and I see people who want them bigger. I see people who want them smaller, people who want them lifted. And the people who want them bigger look at other people who want them smaller and think, crikey, why do they want God, they're so lucky. Why do they want and the people on the smaller look at the ones who want them bigger and think, wow, they look. So it's very subjective, basically. it is not an objective thing. It is not like when you're doing cancer removal, when you're doing cancer surgery, you have a cancer, you have the borders, you have the histology, you know what you got to do, you know what sort of thing you got to do. It's quite well, your colleague, everyone would agree that is the best form of treatment for it. But you have a cosmetic a patient who has aesthetic issues. You can show it to 10 surgeons who'd say, I do this, I do that, I do the other. At the end of the day, it's up to what the patient wants. Classic examples of breast lifts, breast implants, breast lifts with implants, and I see people discussing this sort of stuff in the plastic surgery conferences and things. And you can discuss it to a degree. You can say, I think this will be good or that will be good. But at the end of the day, it really is up to the patient what they want. Sometimes it's like, oh, you definitely need a lift. I'm not going to do implants on you. You definitely need a lift, or you definitely don't need a lift. But often people are sort of borderline, think, well, could have a lift, shape would be better, but look at all the scars and complications. Maybe you could just have implants and shape wouldn't be quite as good, but you'd have volume, nipples would still be low. You'd have this conversation with patients. So, similarly with tummy, mini tummy tuck, full tummy tuck, fleur-de-lis, circumferential, all different types of tummy tucks, liposuction. So there's all sorts of things that can be done, but it really depends on what you want and what your goals are. You'll see some people say, oh yeah, do a tummy tuck, do some lipo to the hips and stuff. Well, I quite like my hips. I don't want my hips done. Well, don't have lipo then. We'll leave the hips. I don't know. It's what you want. I'm not going to say you need lipo to your hips if you like your hips. It's like, well, then don't have lipo to your hips. You might like your tummy. Well, don't have a tummy tuck then if you're happy with your tummy. It doesn't bother you, but my breasts really bother you. Have your breasts then. So it really depends on what bothers you. It's if you say I've lost 11 pounds, what can I do? Do me. I'd be like, do you what? I would be very much, what don't you like? You don't like it? Well, then what's it about the breast? Is it the shape? Is it the size? What is it? Is it both? Well, we could do this to make the shape better. The size would be the same. If you want to have size better, then you need this. So it needs a discussion. It's a two-way street. And it's very difficult to when right. Right. Okay. So when is okay? So you weren't asking what? Okay. Right. So I'll ask a different question. Okay. Well, there you go. Well, when was the question? When to have plastic surgery? Right. Sorry about that. Okay. Well, that's embarrassing. Okay. So when? Well, usually you want to be stable and comfortable with your weight for a period of time. It's a little bit different in the private sector than in the public sector, because often there's quite strict criteria in the public sector, but it's not quite so strict in the private sector. So I try and do it as a work with both of us. But things like 6 months stable with your weight is a reasonable thing. You have to be true to yourself. You want to get the best result possible. You don't want to have significant weight fluctuations. And the problem when you've lost a lot of weight is you are liable, or maybe liable is not the word, susceptible to potential weight fluctuations in the future. So you want to have a pretty good idea that your weight's going to be stable before you undergo surgery, because all the surgery that you're going to need is going to be big surgery. All of it is big surgery. Tummy tucks, thigh lifts, breast lifts, whatever. It's all big. So you don't really want to have a big surgery if you then put on weight, and particularly put on and lose weight. That's the things that does it to you. So if you put on weight and lose weight after surgery, the skin's going to stretch. You are not going to be protected just because you've spent thousands, and it is thousands of pounds. It's very expensive surgery. So you don't want to have all this expensive surgery if there is a chance that your weight is going to fluctuate post-op. So I would say 6 months is a reasonable thing to aim for. So first of all, you have to be stable and comfortable with your weight. So that's the first question. Have you finished losing weight? Are you happy where you are? Are you stable where you are? If the answer to that's no, then really you need to get happy and stable. It doesn't matter what your weight is. A lot of people talk about BMI 30, which is not unreasonable to aim for a BMI 30, but it doesn't matter what your BMI is. Even if your BMI is 30 or 28 or 27 or 25, if you are not happy with your weight, if you want to change your weight either way, lose or gain or whatever, get happy with your weight, get comfortable and stable with your weight at a place where it's sustainable for you and comfortable for you. Ideally, below 30 is where you want to be going for. But as I say, if it's below 30 and you still want to lose, then do carry on losing. And then ideally, if you want it stable for 6 months, I think sometimes they talk about a year or 2 years even. I think sometimes in the NHS stable, which is obviously quite a long time. But it's because there is a high risk of weight fluctuations when you have lost a lot of weight. It is a risk that you're going to go back into bad ways, and you don't really want to be doing that if you've had a tummy tuck, for instance, or well, any of them really, because the skin's going to stretch again. So stable for 6 months is a goal for when. So to answer the when question rather than the what question, which is the one I answered initially. But there you go. So, well, that was a good, I thought. Thank you so much. BMI is 29, Amy 27. Will be 8 stone lost. Look at that. Well done, you. What's the secret? Well, oh, you said, didn't you? Oh, gastric sleeve. Okay, it's not a secret. There you go. Everyone knows. Well done. Keep up the good work. 29 is brilliant, but as I say, don't be lulled into a false sense of security when they say you've got to have a BMI below 30. Doesn't matter what your BMI. 29 is fantastic and fantastic result on that weight loss. But as I say, I try and get people to work with, work together so that we both want the best result for you. Because if you have a tummy tuck, for instance, let's say a tummy tuck or a breast lift, whatever it is now, these operations are basically taking up slack skin, whatever it is, tummy tuck, facelift, arm lift, thigh lift, they're all doing the same thing. They're all taking up slack skin, tightening the skin. And if you have a significant weight loss, 29 to 27 is not insignificant. If you have a significant weight loss after surgery, there might be more slack skin, which will be a bit annoying. You spend thousands of pounds on your breast lift and you get them right, and then you lose weight and it's like, oh, they drooped a bit. It's a bit annoying that. Well, you could have made it tighter if you lost the weight first. So yeah, you want the best result, as do we want the best result. We both want the best result. Everyone wants the best result. So yeah, keep up the good work. 6 months stable is where I will be aiming for. So hope that's been helpful. I don't know about you. I got a too good to go calling. So very much looking forward to some out of date / nearly out of date food. That's my worry. So we'll follow the 6 months. Amazing talks and so informative. Words of wisdom, Douglas Black. JJ for Prime Minister. Who would want that job? Not me. That's faux show. Thank you, Douglas. Very, very kind of you to put me up in the leadership race. But yeah, no, I couldn't do it. It doesn't matter what you do. Someone's going to say you're wrong, isn't it? That's the problem with these apologies. I don't know how they do it. They must be iron constitution. I couldn't do it. Is that right? Constitution, you know what I mean. Loved it. Thank you. How long is recovery after lipo on hips? So, Amy, the beauty of lipo is that the scars are really small. So you just have tiny little stab incisions, which is fabulous because it doesn't look like you've had anything done. Tiny little stab incisions. Having said that, the actual process of liposuction is actually quite traumatic. So you can be lulled into a bit of a false sense of security in terms of the post-op, and you can think you've had nothing done type thing and it's going to look great straight away, and it often doesn't look great straight away. In fact, it can look similar to how you looked before / even sometimes it looks worse than how it looked before, because when you remove the fat you get swelling. So there's quite a lot of swelling, quite a lot of bruising after liposuction, and it's something to be prepared for. So in terms of the sort of physical recovery, I would say a week you'd probably be okay in terms of how you look, and you might be a bit sore, but you'd be able to get back into stuff, into life. But in terms of the cosmetic recovery, in terms of how things look, I normally say, and I say this for pretty much any operation, to be honest with you, it's quite easy, this job. Just you say the same thing for every operation. Starts to settle about 3 months is where I would be on that. But you often get skin irregularities, contour irregularities, feels a bit firm and hard, where you get sort of scarring underneath the skin. You have to massage it, numbness, all sorts of stuff. So starts about 3 months, probably 6, 12, even 18 months for it to properly settle. But after a week, you'd be like looking normal and feeling okay, I would say, on a personal level. So yeah, well, I hope that's been helpful. And if you've got a question, by all means, drop it in and I will do my level best to tackle it. Hold on a minute. Next week. Next Tuesday. I'm over in Liverpool on next Tuesday, aren't I? God, what am I going to do? I'm going to have to do it from the Premier Inn. Facebook Live from the Premier Inn. See you in Bev. See you in 1 week for my surgery. Bev, I've just realised I'm doing surgery now because normally I just do a morning like today and I got home. But next week I'm up there overnight. Oh dear. I don't know what I'm doing next week. I might not do it next week. I can't face doing it from the... Yeah, I can't. Bev, I don't think I can do an all-day operating and then do the Facebook Live. I can't do that, can I? From the Premier Inn, can I do that? Oh, by Premier Inn, I mean like the best inn that they've got in Liverpool, not the Premier, not like the Premier. Don't go to the Premier Inn. I mean, I go to obviously the best inn that they've got in Liverpool. You know, really good inn. But anyway, I'll cross that bridge. May or may not be in next week from a very good inn. Why not? It's easy for you to say, Bev, but I'm going to be, you know, all day in the operating and all the back. My back's going to be like that, and I'm going to be like, oh. And, you know, when I get to the Premier, I just want to watch Antiques Road Trip 7 to 8, 8 to 9, then Movies for Men, and then that's it. Go to bed. That's it. That's my evening. That's my setup. But anyway, don't worry about it. We'll see. We'll see about next week. Watch this space. May or may not be here. Definitely week after, defo. If not, we'll do a rollover for the questions. I think we've rolled over some questions for next week from this week, but it's fine. We never have too many questions. So by all means, please ask a question if you have one. If I will see you next week, definitely Bev. Don't know about everybody else. Might see you next week, maybe the week after. 7:46. Got to get going. Take it easy. Lovely to be back. And yeah, great to start getting back into things again.